Good afternoon, my dear students. Today we will talk about a new muscle, a very important muscle of the scapular region or a superficial muscle of the back, which is trapezius. Okay. Now this muscle is very important clinically also and from exam point of view also. So we'll talk about trapezius today. Now trapezius is a muscle of the back here. Now this muscle which you can feel here, which pains normally when there is neck pain, the muscle that pains, it's generally called trapezitis, or there is inflammation of the trapezius muscle or irritation of the trapezius muscle. So this muscle here is trapezius. It's a very very important muscle of the back of the neck, which takes part in the formation of the posterior triangle also. That will come when we will talk about the neck. So that is this muscle here. Now first we should understand that trapezius is called trapezius because when both the muscles come together, this is the midline, this looks like a trapezium, and that is why trapezius is called trapezius. Okay, so that is the thing. So this is the superficial muscle. This is how it looks. Okay. Now because this is a muscle, you are going to understand this muscle under four headings. That is origin, insertion, nerve supply and action. Okay. Now what is the origin of trapezius? To understand the origin of the trapezius, we have to understand few important things. Okay. I just draw this for you and then we will go ahead. So this is the midline of the back here, okay, center point of the back. The first thing that you can feel here, all of you can feel at the back of the head or back of the skull, there is a protuberance. This is called as external occipital protuberance. Okay, this is external occipital protuberance, which you can feel here. That is the first origin. Then besides that, you have two lines here which go back. These two lines are called as superior nuchal lines. So this is superior nuchal line. Make this with red so that you can understand it. So this is superior nuchal line. So this is the second origin. First origin is external occipital protuberance. Then there is superior nuchal line. And then you have to come here. Okay. These are the 7 cervical vertebrae. But 6 of them are covered by a ligament which is called ligamentum nuchae. Nuchae means neck. So this is ligamentum nuchae, which is going to cover the first 6 cervical vertebrae. So this is ligamentum nuchae, the third origin. The next origin is C7 spine. Okay, the next origin is from the spine of C7, and the other origin, the remaining origin, is from T1 to T12 spine in all the thoracic vertebrae. That is the origin. So it will be originating from T1 to T12 spines. Okay, so I will repeat. What is the origin of trapezius? The first origin is from external occipital protuberance and superior nuchal line. Then you will have ligamentum nuchae, C7 spine and T1 to T12 spines. So this is the origin. Now please understand how these fibers come. The upper fibers are going to come in this way. These fibers are going to come and the lower fibers are going to come in this direction. Okay. So this is how the direction of the fibers is. Now where is this muscle inserted? Now if you draw here, if you draw the scapula like this here, you will have the spine of the scapula, the acromion process like this. Okay. So this is how you have to draw this. Now, if you remember the origin of deltoid, exactly opposite is the insertion of trapezius. Origin of the deltoid was from lower border of the lower lip of the crest of the spine and lateral border of the acromion. Clear? Now, where is the trapezius inserted? These upper fibers will be inserted into the posterior border of the lateral 1/3 of the clavicle. Posterior border of lateral 1/3 of the clavicle here. Okay. Then some of these fibers, the upper and middle fibers, will be inserted onto the medial border of the acromion, and these lower fibers will be inserted into the upper lip of the crest of the spine of the scapula. I will repeat. I will draw this again for you. If this is the scapula, this is the spine of the scapula like this, and this is the clavicle. Okay. So you will have these upper fibers which are inserted on the posterior border of the lateral 1/3 of the clavicle. The middle fibers are inserted into the medial border of the acromion, and other fibers are inserted into the upper lip. The lower fibers are inserted into the upper lip of the crest of the spine of the scapula. So that is the insertion. I hope you have understood the origin and insertion of the trapezius. It's very important here. So it will be inserted like this and here. Okay. So that is the origin and insertion of trapezius. Nerve supply of the trapezius is by the 11th cranial nerve. Now 11th cranial nerve is spinal accessory nerve, or you can say spinal part of accessory nerve. Okay, so that is the 11th cranial nerve. So I hope you have understood this, the origin and the insertion of the trapezius. Now the last part of this muscle is the actions. Now what are the actions of the trapezius? Now here again it is very important to understand the actions of the trapezius. Now what are the actions of the trapezius? The actions of the trapezius are, first, the fibers here which are inserted onto the scapula, meaning the upper fibers, are going to elevate the scapula. Okay, so this action here, these fibers which are inserted onto the upper superior part of the scapula or the upper lip of the crest of the spine of the scapula, they will elevate the scapula. The fibers which are inserted somewhere here, they will be rotating the scapula and help in moving the scapula and helping the serratus anterior in doing overhead abduction, and it is also helpful in forced expiration. The trapezius is also helpful in forced expiration. Okay, so these are some important actions. So it is going to help in elevation of the scapula. This is called shrugging of the scapula. It is going to elevate the scapula, rotate the scapula in such a way that the glenoid cavity faces upwards, and it will help in overhead abduction, and it also helps in forced expiration. Okay, so these are some important actions of the trapezius. Now the last point before we go to the applied anatomy is that the trapezius is the superficial muscle of the neck, and therefore, as we have seen in the deltoid, there are few structures which come under the cover of the deltoid. The structures which are under the cover of the deltoid, as we have of the trapezius, are similar to that like of the deltoid. We have muscles, vessels and nerves, importantly, which will be under the cover of the deltoid. Now the important muscles which are going to be here are the deep muscles of the neck, which are semispinalis capitis, splenius capitis. Then you will have origins of levator scapulae, rhomboides minor and rhomboides major. So these muscles will be under the cover of the trapezius here. When it comes down, you can have it covers all those supraspinatus also and some part of infraspinatus also. Okay, so those are the important muscles. I'll repeat: splenius capitis, semispinalis capitis, which are deep muscles of the neck. Then you will have levator scapulae, rhomboides minor, rhomboides major. Some part of supraspinatus and some part of infraspinatus also. Then the nerves which are under the cover of the trapezius are the spinal accessory nerve itself, which is going to supply the trapezius, and the suprascapular nerve, which is here present at the superior border of the scapula. The vessels which are under the cover of the trapezius will be the transverse cervical artery and the posterior auricular artery. Okay, so that is about the origin, insertion, nerve supply, actions of the trapezius, and also a few structures which are under the cover of the trapezius. Now a very important thing which you have to remember throughout life is that the trapezius, as I told you, is involved many times in irritation. There is irritation of the spinal accessory nerve. The trapezius will undergo spasm, and then there is going to be pain in the neck. So that pain in the neck is also called as wry neck or torticollis. This is involved because spinal accessory nerve is also going to supply sternocleidomastoid also. So both these muscles, this is sternocleidomastoid, this is trapezius, both the muscles can go into the spasm and it can cause torticollis, or it is called wry neck. And then this is trapezius is also, as I told you in the beginning, that it can be inflamed and get pain along the region of the trapezius, and that condition is called trapezitis. Okay, so that is about the trapezius. I hope you have understood this, a small short topic which is again important from exam point of view. A request to all of you again to watch the video, like the video, and kindly share the video and subscribe to my channel. Thank you.